Hi, everyone. Welcome to this SIWI at Home panel and session called Safe Drinking Water, Is It Too Much to Ask? I'll be your moderator, Dan Benna, and I want to thank the co-conveners for this session, Safewater Network, the World Health Organization, World Vision, and the Small Water Enterprise Alliance, India. Before we get into the meat of the session, I wanted to just give a little explanation of what you see on the screen, because I'm a big believer that sometimes distilling down a complicated problem to its root is a good way to start. What you see on the screen is a stylized photo, stylized version of the water molecule. You see the two oxygen atoms and the hydrogen atom. And the reason I put that there is to remind us, ultimately, water is unique in its bond angle and in its chemical properties. And I remember back, 100 years or so ago when I was in college, one of the professors had a quote that said, "To a certain extent, water will dissolve everything on Earth." And that's not hyperbole. So with analytical detection capabilities getting better and better, we're moving from being able to detect parts per million to parts per billion, parts per trillion, and now there are certain contaminants in water that can be detected at the part per quadrillion levels. So there's a certain amount of truth to that statement. Now let's dig into the meat of the session. Next slide, please. I'm your moderator. I'm currently Senior Advisor for Safewater Network, and you can see a little bit more about me on the slide. I do want to say that all of the speakers, the panelists' bios, are available on the website through which you registered for the session. So I urge everyone to learn a little bit about the speakers there. Next slide, please. By way of an agenda, what we'd like to cover today. Obviously the welcome, that's the easy part. Some housekeeping rules. Now with a virtual session, frankly, there aren't a whole lot of housekeeping rules, certainly not as many as there would be in person, but there is one important one, and that is how you, as attendees, get to submit questions. So if you would use the question and answer functionality of the webinar to submit your questions as they come up all along the session, that would be great. And then we have someone that's going to be managing and curating those questions and passing them on to me, so that when we get to the audience Q&A part of the session, we'll be able to have a very rich discussion with the panelists. I also want to point out that on the same website that houses the speaker bios, which again is the registration site that brought you to this panel to be allowed to register, there are also some resources, and there are two documents in particular from the World Health Organization. I urge everyone to look at those resources. It contains a wealth of information as far as WHO's approach to national standards and how guidelines are applied, and some very, very practical guidance in that regard. I'll go through the introductions of the co-conveners and the panelists and the commentator. And then you can see from the rest of the agenda, you can probably tell that I've been dieting recently because I'm using a metaphor about a meal. So we'll start with setting the table, and there'll be 3 minutes of commentary from me just to kind of set the context and get us all onto the same page. Panelist introductory comments. There's a rule of 3 today. Each panelist will have 3 minutes to speak about their background, their organization, and then we'll move into what I call the main part of the meal, and that is the panel. And we have a lot of questions planned, and actually we hope to have even more questions come in again through the Q&A function from the attendees, and that frankly will be the dessert. That in some ways is the best part of this meal that we're setting. It's really important that we hear from you as attendees. We don't want to be a bunch of panelists and moderators kind of talking to ourselves. So do use the Q&A function, get your questions in, and we'll be able to address them at the end. And then finally, we'll have some very quick closing comments. Next slide, please. So by way of introduction of the panelists, as I mentioned on the website, you'll see a little bit more of a detailed bio, but we're really fortunate to have an august panel today. Jennifer DeFrance, the Technical Officer for Drinking Water Safety and Quality from the World Health Organization. Mr. Samuel Diarra, who has been in local government as well as with World Vision for the last several years. He is Senior Director of WASH Quality and Innovation for World Vision International. Mr. Ravindra Suak, country director for Safewater Network India, and he's actually here wearing two hats because not only is he representing Safewater Network India, but he also is representing the Small Water Enterprise Alliance in India, which he'll tell us a little bit more about. Then we have Nat Painter, who will not be on the panel, but he is the Senior Vice President of Partnerships for the Safewater Network, and he'll come in at the end to kind of wrap up and thank everyone for a closing. And last but not least, if you go to the next slide, we have Danielle Ali Garcia. And I want to emphasize Ali's role. You will not see her on camera, nor will you hear her, but she has one of the most pivotal roles for this session, which is she's manning the control room. So when things go smoothly and seamlessly, it's all thanks to Ali. So thanks to our panelists and thanks to Ali and Nat for allowing such a rich session to continue. Next slide. So by setting the table, let's just go through 4 quadrants on one slide of some of the real challenges that we face to set some context. We all are familiar with both the Sustainable Development Goals, which we have 10 years to meet collectively, informing those SDGs, specifically SDG 6 around water and sanitation, is water as a human right. The human rights to water and sanitation are enjoying their 10-year anniversary this year. And that human right to water, as the SDG 6, focus on 5 elements: water safety, which is paramount and certainly most pertinent to this session; water sufficiency; water accessibility; water acceptability; and water affordability. And for a sustainable solution, all 5 of those must work in concert. And that is no small task. In fact, it is fraught with complexity. Next slide. Adding to that, we have challenges that are frankly unparalleled, and you might be familiar with this acronym called VUCA. I've first heard it from an organization called GlobeScan, which is a global survey company. And through many of the insights across developing and developed countries, they've come up with this volatile, uncertain, complex, and ambiguous way of describing the world. And frankly, they've been doing this for years, far before we were struck with the COVID-19 pandemic. So you can see, if anything, I think there's even more merit to this description of a VUCA world. Global threats, volatility like climate change, national security or insecurity, water insecurity, food insecurity, climate insecurity. Just look at the 17 SDGs to understand just how volatile, because of those goals and the things that they are trying to fix, how volatile world in which we live. Uncertain, unstable economies, sadly displaced populations. Virtually once a week, once a month in the news, you can find more coverage of displaced populations, sadly. Complex. Everyone on the call, I'm sure, understands with great certainty the complexity of the intractable challenges that we face. Aging infrastructure. For years, the model for safe water infrastructure was large municipal systems, or at the other end of the spectrum, hand pumps. Well, we'll hear today that there's also something in between, which is a small decentralized approach, almost a micro-utility in some countries. Perhaps that's something to consider going forward to deal with some of this complexity. Certainly within the sector, fragmentation is a huge challenge. So we want to work as best we can to limit and do away with that sort of fragmentation. And then lastly, ambiguous. We'll talk quite at length about this, and largely it's the intent of the national standards that are made based on WHO guidelines, the letter of the law and the spirit of the law. How do you balance what the national standards say for water safety and how you implement them? Next slide, please. Water quality, sadly, is deteriorating, and we know that is exacerbated by a changing climate on so many levels. More frequent flooding events and severe storms. As I sit here today, I had the news on right before the session, and the United States is about to be hit with a hurricane that the force of which they're saying is probably within the top 5 most damaging in our history. Unfortunately, frequency is increasing, severity is increasing, not only of things like severe storms and these quote unquote billion-dollar disasters, but also of drought. I mean, we hear water scarcity stories all the time about, whether it's economic water scarcity or absolute water scarcity. continuing to be an increasing challenge and one with which we will be faced collectively for years to come. Acidification of our waters, greenhouse gases kind of getting at the carrying capacity of our oceans, increasing corrosivity of waters as the pH decreases, being much more corrosive to distribution systems and piping and that water infrastructure that we talked about earlier. And then salinization of aquifers. That is a significant challenge, and particularly when you start to get into brackish levels of salinity, because you are really quite limited with the treatment systems that can cost effectively and effectively address increasingly saline waters. And then lastly, and I alluded to this earlier, the increasing demand of clean water to mitigate the health impacts of pandemics. You probably have heard the statement, water is PPE. And you know, that's a great tagline, but there's a lot that goes behind that, because safe water is really in many ways the first line of defense to battle pandemics like the one with which we're currently grappling. And last slide. It's all about balance, and that's always the hardest part, right? How can we balance the multiple challenges that we face around safe water as a goal? What is free from? What does that mean? What does absent mean? How do we actually apply regulations? How do we enforce them? What if testing capability does not exist? And then lastly, and very importantly, what about the cost? Next slide. So this is just everything in one shot. We're going to be addressing this in much more detail through the panels. And if I can have the next slide, please. I'd like to go into the appetizer, which will be 3 minutes from each panelist to talk about one slide, their organization, and what it is that they intend to bring to this session. So if I have the next slide, we're going to be going in this order that you see on the slide: Jennifer DeFrance first, Samuel Diarra second, followed by Ravi Sewak. Jennifer, if I may ask you to have your 3 minutes, please. Next slide.
Thank you, Dan. It's great to be here, and I'm really happy to see so many participants that have joined this important session. So firstly, Dan, thank you for setting the table so well, and I hope I can follow up with a good appetizer to whet your appetites for a rich discussion. So in my one slide, I wanted to talk about regulations. So as we know, regulations are important for ensuring safe drinking water. But how much is too much? And we heard Dan talk about it's all about balance. And it's within that context, we have the WHO guidelines for drinking water quality. And I specifically emphasize the word guidelines because the intent of the WHO drinking water quality guidelines is that these should be adapted for national circumstances, considering the resources available, the relevant risks, etc. And so it's within this spirit, we have a number of principles I would like to highlight in the guidelines. And these are articulated, and other principles are articulated further in this document that you see on the left side of the screen, Developing Drinking Water Quality Regulations and Standards. This was published in 2018 and provides more practical guidance on how countries can develop or revise their drinking water quality standards to be in line with the principles of the WHO Drinking Water Quality Guidelines. So the first principle listed is about being locally relevant. So the guidelines includes health-based targets, so limits and parameters for over 200 different parameters. So from chemicals, radionuclides, as we know, the E. coli for an indicator for microbial water quality. But the intent is not for all of these to be included in national drinking water quality standards. Countries should decide on which ones are relevant for them. The next principle related to this is about being achievable. It doesn't make sense to have standards if you can't enforce them. It's going to undermine the credibility of those standards. So you need to consider what can actually be achieved, what can be enforced. This goes to parameters. So in selecting parameters, if you can't test for all of your parameters that may be locally relevant, as a stepwise approach, you could start with the most important parameters. This is also relevant to limits. Maybe you cannot achieve the WHO guideline value. So as an interim standard, you could have something higher. And in situations where, for example, arsenic, where it's a huge arsenic problem in the country, and you have a higher guideline value, if you even if you achieve that value, you can have significant public health impacts by reducing concentrations at that high level. So all of this is related to the last bullet point, so apologies, I'm not going in order, but about incremental improvement. Regulations are not supposed to be stagnant. They need to continually be updated as resources allow, as capacities increase, and as situations change. And then the last point I want to raise is about prioritizing risk management. So I've been talking mainly about parameters and related to testing. So testing is a critical part of ensuring safe drinking water, but that's not the only part. The key part is really making sure that producing drinking water is safe. And this is where water safety planning comes in, where you're proactively managing the risks and putting in place controls and monitoring those controls to make sure they're effective before you have water quality problems. So I've listed a few other points, but I think I've ran out of time, so I'll hand it over to you, Dan, and maybe we can discuss some of these things later. Thanks.
Thanks so much, Jennifer. That was great. And again, for everyone, please submit your questions through the Q&A function. And Jennifer mentioned the one resource that is available on the site where you registered. I was reading that last night and strongly recommend it. It's really phenomenal. So without further ado, let's pass the baton to Samuel Diarra for his session.
Hi, everyone. I'm Samuel Diarra. I work for World Vision. I'm happy to talk about filling the gap in water quality. As World Vision is an NGO working to meet the need of poor people and most vulnerable people, we started implementing WASH program in Ghana in 1985. After consulting more than 12,000 water points in Ghana, the evaluation conducted by World Vision in 2003 pointed out the issue of arsenic and fluoride, mostly in Afram Plain. The main policy requirement at that time was to conduct physical-chemical parameters analysis, major element and bacteriological element, with less emphasis on trace element in a very complex hydrogeological and climate change context. One other challenge was, well, if we find arsenic and fluoride, what are the adapted treatment solutions which can be operated locally, be maintained by local people, and also replaced if needed by themselves? As World Vision aims to provide safe water to communities, this is really our commitment. Efforts have been made to find in-country analytical capacity to address base metal issues, but it was unsuccessful, leaving the option of external lab, which we tried to do with Desert Research Institute here in Reno, Nevada. This option to pose a problem of sampling, sending samples to DRI, and also delays in receiving the results. We end up by having serious issues in delay, which was not the best solution because this was ending by delaying also access to safe water by communities, because we set up the goal that if we don't have water quality results that comply with national standard or WHO guideline, we are not going to install any hand pump or any pumping facility. Then World Vision and Huawei partners at that time set and developed a plan. And that plan was really to raise the awareness of everybody, including governments, donors, users, stakeholders, community leaders on the issue of water quality in general, but also in terms of standards, meeting the standard. And this includes as well monitoring their water quality. Then we build the capacity of World Vision staff while we are implementing access to water supply, but also we took care of training district assemblies, decentralized technical team, WASH committees to ensure that they can also handle the water quality issues, at least sampling and sending them to the lab and getting results with some recommendations. And then we establish local water quality capabilities, which include local field equipment, but also a good analytical capacity that was based in Tamale in Ghana to address the issues of trace elements and well-equipped and well-trained for that. So based on that, we got some results. This experience contributed actually to ensure that safe water provision is effective at the source. I'm not saying at household level, at the end of user level, but at the source. And it was allowing us to do early analysis and treat or cap the water point when needed to avoid any exposure of communities to any contaminant. Then, by doing so, we start harnessing data and we develop a good water quality data and learning that can be useful for everybody, and it was shared with respective government and partners. And finally, what just starts digging up, improving, influencing policies at national, regional, and even at global level. And we are still continuing this process with our actual study on the lead occurrence in drinking water. And all this has been possible with partnership. We have leveraged our partnership. Some of our partners I can actually acknowledge here can be DRI, University of North Carolina, WHO, and many other partners who contributed to it. So challenges we have some. I will intentionally leave it to you to ask questions about that. Thank you.
So thank you, Samuel, for that. World Vision has a long history of being very interested in metrics and analytical capability, so it's great to hear your comments. With that, let's move on to Ravindra Sewak from Safewater Network and the Small Water Enterprise Alliance.
Greetings. I represent not only Safewater Network India, but I am fortunate to represent Small Water Enterprises Alliance. You might ask, what is Small Water Enterprise? When you are giving water to 130 crore or 1.3 billion people, not all the water can be treated well. So there are these small water enterprises or water ATMs or water vents that provide drinking and cooking water after treating. Already in India, the governments and philanthropic organizations have set up over 50,000 of these SWEs, potential being more than 200,000. They are all over the country in 23 states, and they provide safe, affordable drinking water, less than 7 cents for 20 liters or 5 gallons of potable water, which is safe to drink for everyone. It also provides livelihoods. And this sector was quite distributed. This is why USAID, Honeywell, Pentair, and Safewater Network got together, and other 15 members of the Small Water Enterprise Alliance members who are coming in to bring safe water to more and more people of India. We are also very cognizant of quality. There are already in India, there are 2 regulations that are governing the water quality. One is the Bureau of Indian Standards, IS 10500, which are drinking water standards. And they are derived from WHO, and it has certain guiding numbers, and also in case of emergency, you have some relaxation in it. This regulation is voluntary currently, and it is likely to be upgraded to a mandatory one even for the municipalities, as the Government of India is giving pipe water network, pipe water connections to all the citizens of India in next 5 years. This IS 10500 is also applicable to the water enterprises. And the governing body for this is Food Safety and Standards Authority, or FSSAI. They have promulgated a law in 2019 mandating 10,500 compliance for all the SWEs. They call it water vending machine standards. In addition to these existing standards, and both these organizations qualify the drinking water labs in the country for testing all the water that anybody sends to them at an affordable price. However, in order to protect the environment, Ministry of Environment and Forest and Climate Change is bringing in a new legislation in India requiring very high level of recovery from the membrane-based systems like reverse osmosis, nano-based filtration, etc. And this law will come into force in October this year as per the guidelines of Honorable National Green Tribunal, which is a high court level of court in India. In addition, as Safewater Network India, we are authoring the standard for the Bureau of Indian Standards for community water treatment plants or any group housing society plant which gives drinking water to more number of people. So these are the initiatives that we are bringing in, and we are working along with all our implementation partners. Thank you so much.
Thank you so much, Ravi. That was a great, really insight into some of the challenges that are faced on the ground by an implementing organization, but also a coalition of other implementing organizations and partners. So we appreciate that. So guys, what we're going to do is, because we're getting a lot of questions in through the Q&A, and it's always aggravating to me when I've been in these sessions where the panel moderator asks the questions and kind of leaves 5 minutes for the audience. So we're going to kind of combine some of the questions that I've had for the panelists with some of the Q&A that have been coming in from the audience. So it will just essentially be one session for Q&A, and I think that might have a richer, less interrupted discussion. Let me ask one, and this is one of the key questions, and it's kind of foundational to number one, the session, and it also brings in some of the concepts that we've heard from our panelists. I'm going to ask this to each of the panelists just for kind of a quick round of response. You know, we hear the term science-based in so many ways now, particularly around climate, the various climate crises that we face. We hear it in fighting the COVID pandemic that, you know, the actions for mitigation have to be science-based. And then with specific regard to safe water, we'll read things online in various standards or guidelines that use phrases like absent or free from. And it begs the question, as a scientist, are those terms scientifically valid? Would they qualify for being science-based? And I'm sure there's very good reasons why the answer is yes, and it kind of gets back to the balance. But I'd like to go through each of the three panelists with just a quick response to that. And let's start with Jennifer, please, from World Health Organization.
Thanks, Dan, for the question. So I think there's different aspects that could be considered in answering this. So one, the WHO drinking water quality guidelines, I mean, there are some contaminants where a health-based value would be 0, and we do have the E. coli guidance value of 0 E. coli per 100 mil. But at the same time, I emphasized earlier about this whole, you know, taking this balanced approach, and you have to consider the safety, public health aspects, as well as feasibility. I think the other part of hearing a lot recently about safe and absence is within the context of the SDGs, where the language is around that. And I think it's important to just point out that SDGs, it's a political goal, right? And also the fact that they're aspirational, and emphasize that countries should be using that as an aspiration, but they need to consider their own local context. So that's something to consider as well. Thank you.
Thanks, Jennifer. Samuel, let me move to you with that same question, because as I mentioned, World Vision has enjoyed a history of really a focus on analysis and metrics and kind of good science when it comes to evaluating water sources. What's your reaction to the use of those terms, free from or absent, from a science-based perspective?
Yeah, I will go just in a practical way to complement what Jennifer rightly said. We have standard, we have policies in place. Now, lab and analytical capacity come to complement those policies and make them effective so that we can say it is scientifically valid to say that this water is free from E. coli or free from any contaminant, or say this contaminant is absent.
Thank you, Samuel. And let me just close out with Ravi, because Ravi, you have a bit of a unique perspective in being in charge of, implementing safe water stations or small water enterprises in India. And on your slide, you had a litany of various current regulations and pending regulations, many of which I'm sure use terminology like free from or absent. So how do you balance that?
In fact, microbial contamination, especially pathogens, if somebody says free from pathogens, it is understood. However, when you come to other elements, which are chemical elements, and there are measurable instruments which can go to, as you mentioned, quadrillion. So then it becomes very difficult to prove free from. Hence, anything which is reasonable, which can be tested at a reasonable cost, should be the standards. I am on the Bureau of Indian Standards Forming Committee, and we try and make it as reasonable as possible. However, it's also about how many times can one test and who does the inspector, who's the inspector who comes to check. Similarly, there are different people previously who used to be responsible. Now, at least it is clear that Food Safety Authority will do it. Similarly, for Environment, Pollution Control Board will do it. So at least that clarity has emerged, and also in a way, how many times it is to be tested. Thank you.
Thank you, Ravi. And kind of following along that theme, particularly around testing, one of the questions that has come in from the audience is they're talking about facing challenges of monitoring water quality, particularly in rural systems. And some of it gets back to the cost, some of it gets back to the complexity. Who among the panel would like to address that question? What hope is there out there for rural systems that do want to do monitoring and surveillance, but need simple, inexpensive methods to do so?
May I take this plunge? Sure. In fact, what happens, one can always test all the parameters at a specified frequency, but there are certain surrogate representatives of water quality and certain, like TDS, they can be tested on remote monitoring systems like we do it every 15 minutes. Similarly, pH is simple to test. And similarly, microbial contamination through simple vial tests are also feasible. So I think while the complete long list can be tested at a specified frequency, however, we should have these indicators to prove, even in rural markets, because we have more than 300 such safe water stations, and all of our alliance partners also test it on a daily basis. Thank you.
Ravi, you bring up a really good point. And Jennifer, I'm going to ask you about this because, in the guidance document that is a resource on the website from WHO, the WHO takes great pain in stipulating the difference between monitoring or surveillance parameters and operational parameters. And I think it's really important to get that balance right, particularly in response to this question for rural communities, because there are an awful lot of test kits out there, increasingly so, that are inexpensive, that may not meet the analytical rigor of a government lab, but they're good nonetheless. And Jennifer, can you share your perspective on that?
Yeah, I'd be happy to, and I'd like to answer the question more broadly as well. So fully agree about these operational parameters. I mean, that's the critical parameters for the day-to-day management. looking at, as I brought up in another session, looking at turbidity and chlorine residual, TDS, et cetera, those kinds of parameters. At the same time, there's innovation in testing, and we hope there will be more that with more field test kits that becomes more accessible in rural areas. There's a real need for that, and a lot of work is going on related to that. But at the same time, these are still tests, and there's other tools that can be used in rural areas as well as in urban areas. But particularly for rural areas, we have simple tools such as the sanitary inspection forms, which are looking to see what are the risk factors within the small systems to determine what actions to take. And then lastly, just to say for testing in rural areas, I mean, in some places, you're gonna have thousands, 20,000 supplies. You can't always test for all of them. And it's really important to make sure that the results that you have from monitoring, it's used to inform the national programming. So the results shouldn't just be used on its own, right, for that supply, but you should collate the results from the area and see what are the trends. Do you see key bottlenecks and help improving the rural situation more broadly that way?
Thank you, Jennifer. And Samuel, I have a question for you, and actually it came in from the audience, and they're specifically kind of focusing it on you, I think, because number one, your experience with World Vision, but also your former experience with the government. And that is, who determines the priority of these parameters? So we heard Jennifer say there's 200 plus parameters on the WHO guidelines. You know, there are fewer than that in most national country standards, but how does that prioritization work?
You know, water quality issues are scientific and then progressive. They are not static, they are dynamic. So actually, WHO has set the guideline, and those guidelines need to be adapted to each country context. And even inside the country, some regions are more exposed to some parameters more than others. And because of that, the water quality monitoring should consider those elements and emphasize on them in a periodic manner to avoid seasonal discrepancies, seasonal changes that may affect people.
Thank you.
And for me, it is the whole partnership. That's the reason why in many countries we have what we call the commission or the committee that sit and discuss those issues. Not only the government saying this is the rule, but also the contribution of other stakeholders is very important.
Thank you, Samuel. And I have to say, you know, I have been a fan of the World Health Organization for years. I mean, since I was designing water treatment systems for PepsiCo years ago. And this guidance document that Jennifer mentioned in her discussion, and which is available as a resource on the site, is really remarkable. And I say that because previously the WHO guidelines that have existed did a great job explaining the toxicology and the health risks and the prevalence and the existence of various contaminants in water. What it didn't do such a great job with is how do you actually take that and apply it with a good level of specificity? This guidance document does just that. So you should think of the guidelines and the guidance document working hand in hand. And I can tell you, if you read through that document, many of the questions about how to prioritize parameters will be answered. And the short answer is it's always a health-based approach, balancing it with risk and balancing it with cost to comply. I'm going to switch gears a little, going from kind of testing and analysis to treatment, because obviously treatment is one of the critical tools that we have to assure safety outside of monitoring and surveillance. And one of the audience members is asking about ceramic filters, but the broader question is, how can we make communities become engaged in owning their own water safety destiny, if you will? So how is it, how do we make it something that they own and that they take an active role in? And one of the ways is by introducing really simple, cost-effective treatment modalities like ceramic filters. I know Potters for Peace has been around for a long time there. I mean, just about every month, there's another company or an entrepreneurial enterprise that's trying to solve the problem of how do you treat water in rural areas simply and cost effectively. So let me ask, this will be a quick round for each of the three panelists. What do you think of this? How do you balance, community ownership with all of the things that we've talked about, grappling with regulations and costs, and then where does household water quality fit relative to going out and getting something perhaps at a community standpipe or at a safe water station and then bringing it home? Ravi, let me start with you.
You see, household ceramic filters are good for a certain range of contaminants. You cannot take care of chemical contamination like fluoride, arsenic, or any other dissolved contaminant like nitrates, or even to that extent pesticides. So if the water is intrinsically clean and potable and you need to polish it, you can do so using a ceramic filter. However, should you need a much better and multi-stage filtration process, a community water system or a small water enterprise would probably be more preferable, because that is more cost effective and less capital intensive for each home. Thank you.
Absolutely. Thank you, Ravi. Samuel, your comments?
Yes, water quality is, once again, is not linked to only one technology. It is good that community members take in hand their water quality, but there is a lot of range of treatment systems that can be used in a community. Not only ceramic filters, but even chlorination is part of it. We have the flocculation systems that are going to play a role, and we have the mitigation of some toxic metals that really need reverse osmosis. So there is a wide range among which we need to select according to the problem.
Absolutely. Thank you, Samuel. And Jennifer, instead of you answering that question, I'm going to shift gears because we're kind of coming close to the end of the session. So I do want to end with one question for each of the panelists. And Jennifer, I'd like to start this one with you. It's a little bit of a kind of a wish list. So, you know, we talked about this idea of a VUCA world, volatile, uncertain, complex, and ambiguous. And we've done, I think, a great job through this rich discussion from all of you, bringing some of those complexities and those challenges to life. But if I were able to have a magic wand and I were to say to each one of you, what is the one thing that you would be able to be granted magically that would significantly improve the safety of water, of drinking water globally, what would that one thing be? So Jennifer, let me start with you.
What would be the one thing for ensuring safe drinking water? Well, I think from the WHO guidelines for drinking water quality perspective, this would be having effective implementation for the framework for safe drinking water. So I'm kind of answering this sneakily because that framework is quite big, but that is the key recommendation in the guidelines. We need effective standards, we need good risk management, and we need good independent surveillance.
I think that's a perfect answer, Jennifer. It doesn't have to be small. It can be big and multi-component, but when it works, and that does. Samuel, what's your wish list? One item, one thing to do.
The knowledge of your water. You need to know what is the content of your water. What are the risks associated to your water point or to the water in the household, and address it effectively, then the problem is solved.
Thank you, Samuel. That's a great answer. And it's, you know, obviously not only knowing what's at the source, designing the treatment accordingly, putting the right monitoring and surveillance and operational parameters in place. And the other component, which unfortunately we didn't get a chance to talk about, is consumer expectations, right? The consumers have expectations of what safe water is. Sometimes they're accurate, sometimes they're not, but it doesn't make them any less important. And that's another whole component of this, which further adds to the complexity and frankly, some of the fun, because it really is an interesting discussion to get into. Ravi, let me give you the final word on that wish list.
Actually, Jennifer took the implementation. So I'll take the second best answer I have is the consumer awareness of handling safe water. You can give the best water to all the people in the world, but if they do not handle it, this water will not be safe to the lips. And that's where awareness, consumer awareness is extremely important.
You guys, you're amazing. I wish we had 2 hours for a real intensive workshop on this, because we've really just scratched the surface of kind of what safe drinking water is, and is it too much to ask? And I think by the end of this, everyone should agree it's certainly not too much to ask, and there are proven channels through which we can assure that, thanks to organizations like those that you see here. So I'd like to thank the audience for participating and all of your Q&As. I'd like to thank the panelists, and with that, I'd like to turn it over to Nat Painter for closing comments.
Terrific. Thank you, Dan. And again, thank you for the participants and the panelists for this really engaging conversation. So much to take away from what we're seeing here and from the exciting conversation. Really pleased to be a part of a conversation that began years ago, and clearly we need to keep driving it forward. I think that's what I really took away from this is some of the exciting and opportunistic challenges we're seeing around balancing the standards, the regulations with the practical application on the ground. Be that access to testing kits, affordability of testing kits, and also I really love Jennifer's point about making sure you use the data. The data are not simply there for interest, but really applying it to national policies as well as operational performance. So with that, thank you again for attending, and also would like to reiterate the thanks to Ale Garcia Ramirez for making this happen. In our office, if you want to get stuff done, you go to Ale. So we'd like to wish you all a VUCA-free day, and inshallah, we look forward to seeing you all in person at World Water Week 2021. Thank you.